How are we doing?
Ready when you are.
Are you ready? Good afternoon. It's a good afternoon. We got our kids back in school. We're very happy about this. We are most hopeful that if we continue our masking work, if we're careful, which our educators have been, if parents continue their desire to have their kids have a good education, and if more Washingtonians get the vaccine, our children should be able to remain in school. And that's something we should be very committed to and very happy about. But that is dependent on the ability of Washingtonians to pull on the rope more than we are right now to make sure our kids can stay in school. And that means using our masks and more people getting vaccines, a safe, effective, free vaccine. We know masking is one of the things we can do. It's very important to protect all of us, but particularly those who cannot protect themselves. Those are kids under the age of 12 who cannot get the vaccine. That includes people who are immunocompromised in some sense. A mask helps everyone, but when we wear it, it particularly helps those innocent children who cannot protect themselves with a vaccine under 12. It allows us, hopefully, to continue to allow them to be in school, and it protects our loved ones who can't take the vaccine because they're immunocompromised in some sense. Therefore, today I'm announcing that effective Monday, we will expand our current facial covering requirement to include large outdoor events of over 500 people. It's very similar to the measures recently adopted by King and Pierce County. Again, this is an expansion of our existing order for everyone age 5 and up to wear masks in all indoor public settings as well, regardless of vaccination status. So this adds to that essentially existing requirement. For anyone wondering why we're doing this, I guess it should be pretty obvious, is because we're seeing evidence of transmission, unfortunately, in outdoor settings. At the Watershed Festival at the Gorge, led to more than 200 infections from that one event, and it was outdoors. The outdoors remain the safest place for people to be, we understand that. But when people are packed tightly together, we're getting transmission and ultimate hospitalizations and death. When you combine large crowds with the Delta variant, without any mitigation measures in place, we're going to keep seeing these super spreader events, even in outdoor environments. Science has proven that masks can reduce the risk of those transmissions. Now, today is a great day to be fully vaccinated against COVID-19. If you're unvaccinated, meaning in some counties you are 50 times more likely to be hospitalized from COVID. So I hope people make plans today. Good day to do it. If we can take a look at where we are in hospitalizations in the state. Unfortunately, is our graph up there, Josie? Yes, okay. So unfortunately, our hospitalization rates continue to climb. They are at the highest level ever during this pandemic. Now just pause for a second and think about what that means. When we started this pandemic, we were hoping, praying for a vaccine that could knock it down and keep it at bay. And yet, even though we have it, we still have hospitalizations going through the roof. And in most places in the state of Washington today, hospitals have already had to curtail some of their normal procedures because they're so jammed with COVID patients. This is not acceptable to us. We've got to take measures to not allow our hospitals to be overrun. Because our hospitals are increasingly overwhelmed with COVID patients, more than 90% of them are unvaccinated. In Northern Idaho, hospitals are now rationing care under a crisis standard of care because they've been overwhelmed with COVID patients. We certainly need our friends in Idaho government to do more to preserve their citizens' health, because we know that their medical crisis is becoming our problem as patients from Idaho would need to cross over to Eastern Washington hospitals. Those hospitals are already under great stress because of our own COVID patients. So I'm asking the people of Idaho to adopt some of the safety measures like masking requirements that we have in Washington, so we can help both our states reduce this horrible pandemic. That and increased vaccinations will reduce the strain on our hospitals, because we are all in this together, and I hope people will think about it in these terms across the border. We know that our vaccination efforts are actions of compassion across borders. Now, unfortunately, we see COVID activity hitting us big time in Western Washington as well as Eastern Washington. The morgues and funeral homes in Cowlitz County are at capacity. They've had to get refrigerated trucks to hold the deceased so that they can be treated with dignity. And the other tragedy is we have local leaders sometimes who aren't looking for answers to this problem, but rather for excuses for inaction. That is a deadly situation. And unfortunately, we have a disparity in our vaccination rates in our counties. We're just taking a look at our graph to show our vaccination rates as percentage of populations of those over 12. We'll see the highest is 84% in San Juan, then King at 83. We go down to Ferry at 43, Soden 41, and Stevens at 35. This is just a recipe for disaster in these communities with these low vaccination rates. And that's why we're seeing the hospitals in Tri-Cities and other places that are being overwhelmed because of these low vaccination rates. And I hope that we can do better. Now, if I can, I'd like to talk about some of our vaccination requirements. And by the way, I'm pleased to see President Biden showing leadership today in this regard. He recognizes this as a national problem, and I'm glad he stepped up to the plate to help us across the United States. But look, I just want to address this issue of the decision to be non-vaccinated. And I've heard some people say that it's just sort of an individual decision. That is just so far from the truth. The fact is, when you make a decision to not be vaccinated, it is not just about your health. It is about the health of everyone around you. And we need more people to think a little less about me and start thinking a little more about we. This is not about you. It is about us. It is about whether or not we will allow you to infect our children and our grandchildren because you have not been vaccinated. It is about whether we will allow you to infect your co-workers because you are not vaccinated. It is about whether or not we will allow you to force nurses who have been under this incredible stress for the last year and a half to have to explain more to their families why their family member may not ever come off the ventilator. This is what this is about. It's about a public responsibility. And we are asking more people, and we need more people to step up to the plate. And I have to tell you, there's a lot of frustration by those who are vaccinated that they have to bear the burden of this irresponsible behavior. Look, I don't think it's a great thing you have to wear a mask to go to a Husky game. I wish that were not so. But the reason is because so many people have refused to become vaccinated. And I hope we will have a little more publicly spirited attitude so that we can fight this together. We all are in this together. And the only way out of this is vaccinations. So I'm pleased that we're moving forward in this regard because we need to. I want to show you the epi curve where we are on positive cases. This shows our positive cases are at the highest they've ever been per 100,000, and they continue to go up. Fortunately, they're not going up as steeply as they are, but unfortunately, they are continuing to go up. So it is time for people to stop listening to conspiracy theories about microchips in this vaccine and start listening to their physicians. And we are asking people to speak to their physicians about this vaccine. If you are giving consideration to not being vaccinated, we're asking you to get the straight information from your physician. And we're pleased that physicians and nurses across the state, tens of thousands of them, have joined us in the effort to talk to their patients about the actual science behind these vaccines. We appreciate their effort. This vaccine is a miracle people have been looking for. Let's put it to work for us. Now, many more employers around the state and the nation, both public and private, continue to recognize the perils of unvaccinated folks. They're requiring vaccinations to protect their workers and the communities where they reside. They know it works. They know it saved lives. They know it has been scientifically proven. Over 300 million shots have been given without severe untoward effects. Now, and President Biden, of course, just issued an order regarding employers of over 100, and for public and federal employees to be vaccinated, including those in Head Start and a wide variety. We hope that people note that the federal government has now joined the state of Washington in an effort to reduce this pandemic by increasing vaccinations. We think it's the right decision. So these are big steps are being taken, but little tiny baby steps are not adequate to the task. Look, just before I walked in here, I just got the today's numbers. 4,240 Washingtonians were positive yesterday. 252 Washingtonians were newly hospitalized. 252 in one single day. 59 Washingtonians yesterday died because of COVID. Almost all of them were all preventable deaths. We got to understand how severe this is. More people die of COVID every 3 days than died on September 11th in the terrorist attacks. This is not a time for little tiny baby steps to attack something that's killing our people. And we're going to continue on this course. Our efforts are moving forward on our requirement for vaccinations for state employees and those in education and healthcare. I'm pleased that that is progressing accordingly. I also want to thank Jefferson and Clallam counties for requiring proof of vaccination for bar and restaurant patrons. I think this is something more counties can do. I want to thank the Seahawks, the Kraken, the Sounders, the Cougars, and the Huskies, and others who are requiring vaccine verification for their games. These measures protect attendees, players, and staff, and ultimately all of us. It's the kind of measure we might consider on a wider basis as this pandemic increases. We are considering measures where the state can help move in this direction. I have not made final decisions in this regard. But it is clear that we need to put pedal to the metal against this pandemic. With that, I'm joined with Dr. Shah for comments. Dr. Shah. Oh, yes, he's here. How about that? It's a miracle.
The transition is complete. That's right. That's right. Good afternoon. My name is Dr. Umair Shah. I'm the Secretary of Health for the great state of Washington. And Governor, thank you for your comments just now. I wanted to start by thanking all of you for being here, our Washingtonians, and in particular, I want to thank our public health and healthcare workers who are working tirelessly across the system. This is a very difficult time in both the public health and healthcare systems at the local community level, and we know so much is happening. And today, the theme that the governor outlined is that we at the state are taking actions, and we're taking actions that we know are going to help, but we're also asking for the help of our community members. We are asking our community members to do the right thing by getting vaccinated, masking up, and certainly doing everything they can to champion the cause of fighting this pandemic. We are, as the governor said, in our fifth wave, and as you know, and as the governor highlighted, we're hoping that they are starting to slow the trajectory, but the trajectory still does not change the fact that we have extremely high number of cases every single day that are being confirmed. In addition to that, we are still seeing hospitalizations at an extremely high number. Not only is that from COVID-19, but it's from all the other reasons that people go to the healthcare system. We still want to make sure that it's clear to our community that the healthcare system is there to take care of their healthcare needs. However, we also need to get help from our community members to make sure that we support the healthcare workers. We can always thank our healthcare workers, and we've been doing that for 18 plus months. But ultimately, this isn't just about thanking people, it's also about helping support the work that they are doing within the healthcare system. COVID-related hospital occupancy and ICU occupancy, as you've seen, is at a very high level. And we know that this is largely being driven by a number of factors. In addition to usual care being delivered, this continuing pandemic that rages on is because of two things: Delta variant and those who are unvaccinated. And we want to do everything we can to require where we can or encourage where we can to get people to understand that the Delta variant is here, as well that unvaccinated people, as the governor showed, are very much contributing to people that are in the hospital system. We're likely to see continued increases in hospital admissions in the coming week or weeks, and it's essential to continue to mask up and do everything we can, including getting vaccinated, to prevent transmission in the long term. The healthcare system, as I said a couple of weeks ago, is stressed, it's stretched, and certainly at the end of the day, it is very much strained by what they are seeing in the healthcare system, which includes staff shortages. And as the governor mentioned, the steps that we're taking that he announced for outdoor activities with masking requirements in those activities where you have more than 500 people, that goes into effect on Monday. He mentioned the festival. I'm also going to mention in the last 6 weeks, we've had 5 outdoor events that have became super spreader events in the state of Washington. More than 500 people were infected at these concerts, fairs, rodeos across Washington. As the governor said, we are needing to require in these large events people to wear face masks. Though not required, we strongly recommend that people wear masks anytime they're in a crowded setting, whether that's indoors or outdoors. If you're around somebody you don't know their vaccination status, or even if you know their vaccination status, but you are concerned about the fact that you are too close to them, we are going to say our recommendation is to wear a mask. Masking in public indoor settings is absolutely critical, we know that, but also masking in outdoor settings, especially around other people in crowded situations, just makes common sense because we know masks work. Let me talk for just a moment about the hospital capacity. Again, is currently such that we are doing very many things at the state of Washington, at the state level, to support our healthcare system. Department of Health has been working with the Healthcare Authority and other state agencies, and along with our healthcare partners, in monitoring the situation very carefully. We're continuing to be in touch with our hospitals and knowing what's happening in our hospital systems. Some of the actions that we've been taking is to work with our Washington Medical Coordination Center to handle transfer requests and certainly balance loading across the system, which also has been difficult because of the very challenge with staff shortages and also supporting the very staff members that are needed in order to be able to handle the load. We also continue to call on our hospital healthcare partners to do what they can to limit and curtail elective procedures and anything that's not necessary in the healthcare system so we can assure the balance load that is necessary. In addition, we're also working with our state and federal partners and local community partners on providing staff support, which includes hoping that we can continue to get the support and the help from our community members. Let me close by saying just one other thing, that I'm asking your help, our community, our Washingtonians. I'm asking your help because we can't do this alone. The governor mentioned this is not about the me, this is about the we. This is not about you. This is about us. This is about all of us. We cannot do this without all of you working and helping us to fight this pandemic. This pandemic, in summary, rages on, and it's going to continue to rage on, and our healthcare system will be strained and stressed and stretched unless we do the right things. That includes masking up, and that includes getting vaccinated. My daughter turns 12 today, Governor. I just wanted to make sure to mention that. She is, it's her birthday, so I wanted to wish her happy birthday, but I also want to just share this message from her. She had said to my wife and I, as she turned 12, that we asked her what she wanted for her birthday, and she said she wanted to get vaccinated. And so we have her scheduled tomorrow to get vaccinated. And I know this has been a challenging time for parents as parents send their kids back to school. Certainly my wife and I had a very challenging time just yesterday as we ushered in that day for 2 of our children. But we also know that we as parents and as adults in the community can do what we can to mask up and also get our kids as well as those around us, and if you haven't yourself, get vaccinated. And that's the key message. And so I wanted to wish my daughter happy birthday, but also champion the fact that we need to certainly work towards getting vaccinations, especially for children that are eligible, but also for adults. All of us are in this together. Thank you, Governor.
You bet. Questions?
Governor, can you talk a bit about how the mask mandate will be enforced?
Well, this is a requirement on entities that have these organizational pursuits. It can be enforced through the labor and industries, as we have in all of our other systems that have been considerable effective. I've been pleased by our compliance with our masking requirements and our capacity requirements in restaurants and the like. Where we've had a few outliers, there has been enforcement action where necessary. We start with voluntary compliance. That has been effective in most of the time. But if people are non-compliant, they face, sometimes hundreds of thousands of dollars of fines. And we don't want to have to go that route, but the state certainly will if required.
And yesterday, Maryland's governor announced that his state was not going to wait on the federal government and that he was authorizing booster shots for those 65 and older who are in congregate care settings like nursing homes. Is there any sort of similar plan for that here?
We have not made any decision like that. We're hopeful the federal government will move forward with as much alacrity as possible to make a decision on booster shots. They're working through that. I'm pleased by both the attitude, both to be careful and not skip steps, but also get this done with as much dispatch as possible. I think the administration will do both of those things as appropriate. I feel, I'm in this group. I'm one of the early groups because of my age. I'll just tell you, Trudy and I feel blessed. We think we have a lot of protection today, and certainly a lot more protection than the 95% of the people who are the victims of COVID today because they're not vaccinated. And I feel hundreds, if not thousands of times more protected today, even though I haven't had a booster yet, than the folks who are not vaccinated. And I'm concerned about them. And I'm concerned about their relatives to have to go to their memorial service. It is very, very painful. I went to a memorial service for a Department of Corrections officer in Hoquiam a few weeks ago. And I listened to his 9-year-old daughter give a eulogy, and it was very eloquent. Obviously, she loved this man who was in his early 40s. And I just thought, if we could have got him vaccinated a few months ago, she'd be hugging him instead of going to his memorial, and it was very, very painful. And it certainly, I think, justifies what we're doing to get more people vaccinated, certainly in state employment. And that's why we're moving in that direction.
For the Health Secretary, 2 questions. Can you give us an update on vaccination efforts, how they're going in Washington right now? And do you have any sense of what the President's vaccine mandate will mean in terms of that progress in Washington State?
Yeah, so, as we've said that, we have done everything in the state of Washington that we can think of to increase access, make it affordable, make it available, and to make sure that at the end of the day, that we are championing the messages for vaccinations. There is adequate supply in the state of Washington for vaccines, and we want to make sure that those who are needing to get vaccinated or wanting to get vaccinated, that they're able to get vaccinated. We have seen a softening of demand over the last several weeks to months, and what we have seen over the last few weeks, ever since the governor made the announcement, as well as the additional concerns around Delta strain, that we've started to see an increase in vaccination rates. The last numbers that I saw was over a 30% increase over 2 weeks of vaccines, but that still is not enough. As far as what the administration at the federal level has announced, I do think all of these efforts, as the governor mentioned, are critical to supporting the work that we're doing in the state of Washington. We're part of an ecosystem. That ecosystem is not just what's happening within the borders of Washington. It's in our region, but it's also across the country. So whatever the federal government can do to support, whatever we can do to be consistent with what's happening at the federal level from a vaccination standpoint will certainly help us. So we do believe that we've seen an increase. We do see that increase continuing. But again, we need to get those numbers far ahead in order to get to those who are unvaccinated still. And as the governor mentioned, we still have quite a few people that are in that category.
Secretary, I'm going to ask you a couple of questions too about the status of the healthcare system and the strain.
Yeah.
At the beginning of the pandemic, we were concerned about ventilators. Does the state have enough ventilators? Do they have enough refrigeration trucks? Can you talk a little bit about how much, you were talking about the patient loading, how much of that is actually going on the west side of the state versus the east side? And then secondly, you mentioned some super spreader events. What about churches, outdoor events, and the number of churches that traditionally have a lot of outdoor events regularly? Are they also a source of infection?
Yeah, at this time, we have the state resources to be able to handle what's happening within our healthcare system. But again, you know, as I've said before, it's like a rubber band. If you stretch a rubber band, eventually the rubber band breaks. And we want to make sure we can continue to handle what's happening within the healthcare system. Healthcare system is incredibly resilient. It stretches quite a bit. It surges on Saturday nights that are busy in the emergency department or in the ICU or in the hospital system, but you cannot sustain that over time. That is also at a time when staff shortages have certainly been a challenge throughout the country. And so this is something that we have to remind Washingtonians that we're not just competing with what's happening for resources in the state of Washington. Those same resources are taxed throughout the country, and certainly with Hurricane Ida, that's also made it very challenging because there have been federal deployments that have occurred not just in the Gulf Coast but in the northeast part of the U.S. that have also taxed what resources are available from the federal government. So overall, yes, we have those resources that are necessary today, but that does not mean that we can continue to stretch our system, because at some point it could break, and that's why we want to do everything we can to prevent it. The second question that you had was about the balance load, patient load across the system. And I will say that the Washington Medical Coordination Center, we're getting briefings from them on our team on a daily basis, and we're having conversations and dialogue with them throughout. They're actually doing an incredible job to move patients across systems. And I wouldn't say it's an east-west or west-east, north-south issue. It's really a bed availability issue. It's where you have available beds, and we're having those patients being moved over into those hospitals or healthcare systems that can handle the load. At the same time, we're also working on things like complicated discharge or patients who are difficult to get out of the healthcare system. We're working to transfer them into other settings, which will make it easier for those hospitals to decompress.
Just to follow up real quick on his resource question, I know earlier the governor said, and you said as well, we're accepting patients from Idaho into eastern Washington. Is there a point where we have to tell Idaho that no, we can no longer accept your patients because of the concerns about capacity for people in Washington state?
I think the thing we have to remember is that, for example, Spokane Regional, it's a regional center for not just what's happening in Washington, but also in other parts of this region. We're proud of what our hospital healthcare system have done from a regional standpoint of supporting other states. Absolutely, that's a critical need that we've had throughout this pandemic and well beyond, in other kinds of events like wildfires and other activities issues that happen in the state of Washington or in other states that are neighboring. But at some point, we are going to need to continue to look at that, the number of patients that are coming into our system, and if we feel that is impacting significantly what's occurring in our system. So let me be clear. Right now, I can't say it's significantly impacting our system. So when we believe that it's significantly impacting our system, we may need to take additional steps. Governor, I don't know if you wanted to add anything on that one.
Oh, just one thing I'd like to add, as far as vaccines, in order to comply with the state requirement for vaccination in state employment, if people want to use the Pfizer vaccine as their avenue, they'll need to start their first vaccination by midnight this Sunday in order to comply to meet the October 18th full vaccination deadline. People need to think about that. This is not a time to wait. It's a time to vaccinate. We hope that that'll happen.
Governor, we're coming up on a lot of county fairs and other large outdoor events happening. Given what we're seeing in hospitals, do you think that they should be continuing to go on, or are these mask mandates and other things enough to kind of prevent super spreader events?
Well, at the moment, we think the mask is the right thing to do, and that's why we're making this decision today. We can't guarantee we won't make some other decision in the future. But what we have tried to do is avoid shutting down our economy and our lives, which we had to do when we started this when we didn't have a vaccine. We shut down our economy. Restaurants weren't open. Businesses were not open. Fairs were not open. Games were not open. That's the thing we had to do to save ourselves from this rampaging pandemic. Now we've got a vaccine and masks, and we need to use both of those to avoid shutting down our whole economy. And frankly, sometimes it can be a little frustrating that the people who whined about the decisions we made early that saved ourselves from this pandemic now turn around and don't want to get vaccinated and are allowing this thing to continue to rampage. We're taking a measure which will try to save businesses and save the ability of people to go to restaurants and the like. That's the measure and the strategy that we are adopting. We hope they will be successful. There's every reason to believe they will if people will start getting vaccinated. But they need to, and we need to hurry up about that business. There's no time for excuses anymore. The time for excuses is long past. It's time for action now.
Governor, is there potential, though, that if the mask mandates don't do the trick and if vaccinations stall, that you will need to shut down the economy one more time?
As I've said for the last year and a half, we're taking nothing off the table. We have no plans to do that. We're not considering to do that. But you can't eliminate things that you might have to do in the future.
You did say you were considering, it sounds like you're considering a statewide vaccine verification process similar to what King County is going to launch soon. Is that right? Is that, and what do you envision, what are some of the factors of making that decision? How do you see that?
Our Department of Health is working with King County and some other vendors to see if there's a mechanism to have a state-operated way to have easy verification for vaccination status. And they're working through some of the technical issues to see if that can be determined. So that's not something that's going to happen in the next few days, but we are looking at it, working at it to see if we can make it easier for businesses to fulfill that decision, either because they want to or because it's mandated by the state. And that is something that, is under consideration. We cannot allow a situation where you can't get your heart attack to be cared for. We cannot allow a situation where you get in a car wreck, you can't get medical care. And that's where we're heading right now. We're already seeing situations that you can't get your surgery done for knees and the like because there's not room in the hospitals. And we're not going to allow our schools to be victimized by the unvaccinated. We want to keep these kids in school. So one way or another, we're going to be committed to that.
Governor, what are you expecting in terms of attrition from state employment because of your vaccine mandate, and what sort of contingency plans are being put in place? And I do have a quick follow-up when you're done for Dr. Shah.
We believe as time goes on, more and more public servants will decide to get the vaccination. We think that is happening as we speak. And the principal reason is people who have gone into state employment have a public service ethos. They believe in public service. They want to help other people. That's why they went into public service. And as more of them understand the ramifications of being unvaccinated, that it jeopardizes our kids' education, that it jeopardizes other people's lives, more and more people will follow that publicly spirited value system that they have. So I think the vast majority of people will be vaccinated. Our agencies are doing contingency planning for those few who decide not to. And I've looked at some of their preliminary plans. I think they're realistic. And we're going to get through this. Because I do believe people, when they start to talk to their families, particularly when they talk to their physicians, and sorry if I've said this before, but I really am asking state employees, before you make a decision to lose your career, we want to keep you. You're doing good work. The public depends on you. Don't jeopardize a career without talking to your physician about this. Your physician will give you the straight scoop. Now, I have heard some people who have been hesitant to date to get the vaccine. You know, that's not shocking that there's some hesitancy. This is a new vaccine. But I've heard some people say, well, I just don't trust the government. Okay, that may be the case. But you do trust your physician when you get cancer and you follow his or her advice. You do trust your physician when you have a heart attack, and when they say you need a drug, you take it. And when you have a possibility of getting a fatal disease that killed 59 people yesterday, hopefully you'll trust your physician. And we just hope people will have those conversations. As they do, more and more people are going to get vaccinated. Do you have a question for Dr. Shah?
Just briefly, Dr. Shah, can you define a super spreader event? What is that, and can you name those 5 outdoor events? This is for a colleague, I believe.
Yeah, I can't name the events right off, but we can get that information for you. But really what we're defining a super spreader event are events that are a mass of people that come together, and certainly that mass of people come together and they don't have the masks or they're not vaccinated, and then after the fact we have numbers of people that actually get COVID-19 transmission is then epidemiologically linked back to that event. So it really is, it gets particularly to what's happening at the event, the crowded nature of that event, the size of that event, but also the number of people that come back and get linked to it. And so epidemiologically speaking, I don't want to get too technical here, but we then look at that from a number standpoint and then make a decision that's a super spreader event or a spreader event that is of concern. And that's what we're trying to prevent moving forward. Thanks.
Governor, a few minutes ago, you said that it's not a time for taking itty-bitty steps. Looking at your charts, COVID cases are up 6 times since compared to last September. Hospitalizations are up 4 times compared to last September. Why aren't you doing more, such as limiting capacity in stores and restaurants?
Because we're doing the things that we know that work, and they're readily available, and if we do them, we will beat this pandemic. Look, this is a no-brainer. If people all get vaccinated, we're gonna knock this thing down almost nothing. And this is available to us. It is free. It is almost painless. I didn't even notice when I got the shot. And if people will think about their public obligation and their family and their kids, we'll wreck COVID. This is available to us. So there's no reason not to focus our energies on getting that job done when it is a very achievable goal. When you have a tool that's going to save lives, we ought to use it, and that's where we're focusing on that. Now, masks are also more inconvenient to all of us, and again, I wish people were vaccinated didn't have to put a mask on. But, and they are somewhat aggravated that the unvaccinated are putting them into that position. I share that aggravation. But we know masks work. So anyway, we have tools, we know they work, that's why we want to use them.
Do you rule out the rollbacks?
As I've said now 542,000 times, we're not ruling out anything in the future. We don't know how bad this is going to get. We don't know how many people are going to get vaccinated. We hope a lot more. It should not be necessary. It should not be necessary because we have a mechanism to make it not necessary. That's to get a vaccine. So if we'll just do simple, safe, effective things, we'll be out of the woods.
Governor, I think Nick has something to add.
Oh, I'm sorry.
Just wanted to
Oh, Nick,
quickly,
yeah.
the governor's remarks and refer to an answer he gave earlier related to a similar question, where when we implemented those measures and restrictions on the economy, we didn't have the tool of vaccines. We have that tool today, and that's the tool that we're focused on using in order to curb the pandemic.
Thank you, Nick.
Yes, Governor, a question about the eviction moratorium. There's some housing organizations in King County who are asking for an extension perhaps to the end of the year for your bridge because King County's been slow, they say, to get some of the funds out to folks who need it. Any chance that that bridge could be extended once in the future?
We're not seriously considering that right now, but we are talking to King County to see how they can put pedal to the metal to really get those dollars out. And those will be discussions we're having them in the next few days. So we hope that there can be substantial progress on that and that would not be necessary.
Any idea why this is taking so long to get funds out?
I actually don't know, and I'm going to get briefed on that in the next few days to find out. But there ought to be a solution to this problem that is at hand.
Governor, regarding those employees who are under the vaccine mandate, who might ultimately get a medical or religious exemption, are there plans to regularly test them since they will continue working but will not be vaccinated?
Not right now, and not all of them will be continuing to work because there is an accommodation process to determine whether their needs can be accommodated. Some of them will, but some of them will not. So even though a person qualifies for an exemption, it doesn't mean they qualify for an accommodation if it cannot be made. So it'll be on an individualized basis. There's no blanket statement I can make about that because decisions will be made as to the particular circumstances of the employee and their employment environment.
We're going to go to some virtual questions now. First comes from Caitlin with KNLY. Caitlin, are you there? Okay, we will come back to Caitlin. Next, we'll go to Colette with KHQ.
Hi, this is Colette. My question is for Secretary Shah. I just wanted to know, across the state, are there any hospitals that are nearing the crisis standard of care threshold? And if so, what would those crisis standards of care look like when they're executed?
Thanks for that question. And as you know, Department of Health released a statement yesterday about crisis standards of care. I think it's important to remember that there are healthcare entities, hospitals that are at times using the terms crisis standards of care when what they're really referring to is care that's being delivered in the midst of a crisis. And I don't want to get too technical into this because it's obviously going to be beyond this dialogue here. But I think the key message is that there are certain hospitals that are stating that they are very stretched, and they're not just stretched, but they're extremely stretched. And because of that, they're having some changes to, which by the way is allowed with our emergency proclamations for changing of staffing ratios and how some of that care is being delivered in the four walls of that hospital. But we are not, when you look at the true definition of crisis standards of care, we're not at that point. And certainly we want to do everything we can as a system to prevent it, and also obviously have to rely on our community members. So I don't want to get too technical, but that is the truth of it, is that we are really very careful on the use of that word, that set of words, because that nomenclature is really important. And we're not there yet, and we certainly don't want to ever get there. Governor, did you want to?
Next question comes from Nicole with Pyro Radio.
Good afternoon, Governor. What is our contingency plan for when our hospitals really cannot handle anymore? Is it possible that we could get the National Guard to help us, or field hospitals like we've seen around the country? And then at what point would we see restrictions for the unvaccinated, similar to what Jefferson and Clallam counties and the Mariners and the Sounders and others have done? At what point would we see that statewide?
Well, we would take that action when we thought it made sense, where we had a mechanism for effectuating it, where we saw the infection rate and hospitalization rate continue to go up, and we thought we had a way of actually making this work. As I've indicated, we are actively considering possibilities of that, and we are actively considering a mechanism of making it easier for the businesses to identify those who actually are actually vaccinated. So those things are under active consideration. We are in that type of danger zone in our hospitalization at the moment. Your first question is, we are already looking for medical assistance. We have contracts with national contracting firms to bring in healthcare providers already. But ultimately, that's really not the solution, because the whole country is stressed in this regard. And yes, we might have some National Guard to come and help, but every state has, in some degree, a demand in this regard. So we can't count on that for our ultimate salvation. When you think about this thing, there's a salvation here, and it starts with V, and it's vaccination. And that's what we need to emphasize.
We're going to go back and try Caitlin again with KXLY.
Hi, Governor. This is Jonathan filling in for Caitlin. In Spokane, we have the county fair starting this weekend. Does this mandate apply to fairs like this, since everyone is spread out outside, unlike concerts? And if so, can you explain why?
It does apply where there's over 500 attendees. I presume there'll be more than that at the fair. So yes, it does apply, and the reason is we want to keep people from dying. And this is an effective way to do it. And the reason we have to do this is because not enough people in Spokane County have become vaccinated. And when we get enough people to be vaccinated in Spokane County, we'll be able to drop these mask requirements ultimately, I believe. But we're a long ways from that right now. We need a lot more people to pull on the rope, and I hope that they will. This is a matter of patriotism to our community right now.
We have time for about one or two more follow-up questions from anyone in the room.
Okay.
Governor, what is your thinking in terms of, again, going back to that state mandate and contingency planning? Do you have any concern at this point about the safe operation of prisons or other state institutions after effectively?
Well, of course, we are preparing contingency plans to consider if there is some reduction in employment. So yes, we're doing that. That's just standard operating procedure. We do that in many circumstances. But I do not believe that public employees ultimately are going to shirk their duty to the public. I believe people will be motivated by their desire to help people rather than to hurt them. I believe they'll be motivated by keeping a good career. And I hope they'll be motivated by our desire to continue them to be on this team. So I think those will ultimately prevail, and the vast, vast majority of people will continue to do the great work that they're doing, and we want to accommodate that. That's what I believe.
Do you know how many state workers are vaccinated this week?
Do not. We are obviously going to be getting that information in the weeks to come. We don't have a number right now because we have not received, nor we have requested or demanded information from the employees yet about that.
The Los Angeles School Board is looking at making vaccines mandatory for all students 12 and up in, I think, the largest school district in the country. Any path you see the state of Washington taking like that?
We're not doing this at this time.
Do you think, Streuli, do you think that the agreement that WFC has negotiated with your administration, do you expect to extend those accommodations, if you will, to all state employees?
We have separate units that we bargain and negotiate these agreements with, and each one is separate. But so far, I think that template is a good one. With the ferry unions, we've reached something that's fairly equivalent to that. I think it's a good template, so I hope we'll succeed on that in as many situations as we can. But there does have to be bargaining negotiations with each individual unit.
But no testing alternative?
No, we are not doing testing alternatives. We have found that they are inadequate to protect our people, our citizens, and our co-workers. They simply don't work adequately. The person that I went to their memorial down in Hoquiam had tested negative like 30 times. And then he ended up in a casket in Hoquiam. So we have to have vaccinations here. Okay, with that, anything else? I want to thank you. I hope that you will be well. And I hope all Washingtonians join their relatives and their co-workers in a discussion of this issue. We all can be leaders here. I hope that physicians talk to their patients about this, as many, many of them are doing. I hope that mothers talk to their sons and daughters. I hope grandkids talk to their grandparents about this. Because if we express our love for each other and a little bit of inspiration to come help the public, to come, sort of fulfill a duty to our kids to not infect them, we're all going to do a lot better in defeating COVID. Vaccine's the way home here. Let's go home. Thanks.